Thank you for joining me today for our session on diversity, innovation, and tri-sector partnership in global public health. I'm delighted to be here today with all of you, and I have three knowledgeable, experienced, and altogether fantastic guests with whom to explore this topic together. I don't think it's going to be a surprise to any of you that the most pressing global public health challenges require truly global collaboration. That's why PYXERA Global with the Global Health Fellows Program 2 is excited today to bring together leading voices in global public health in order to discuss these important issues. Now, when we talk about tri-sector, we're referring to organizations and individuals within the private sector, and in this case, we're most often referring to companies, public sector, which is government at any level, and social sector, which consists largely of mission-based nonprofit organizations or social enterprises. Our topic today focuses on tri-sector partnership and the leadership that requires, and particularly why diversity is so important in this regard. Please feel free to join the conversation via Twitter by sending comments and questions to @PYXERA Global using hashtag PYXERA Global 25 or hashtag Global Health. My first guest today is Juan Carlos Hunt, the Director of the Office for Civil Rights and Diversity at the U.S. Agency for International Development, also known as USAID. In this role, Director Hunt works to advance USAID's policy of diversity, inclusion, and transparency, ensuring that the agency maintains the highest standards in promoting equal opportunity and prohibiting discrimination. He also serves as the co-chair of USAID's Executive Diversity Council, working to promote diversity throughout the agency. Welcome, Juan Carlos. We're so delighted to have you here today.
Thank you. It's a great pleasure to be here.
Great. So can you start by just giving us a little bit of an overview about diversity and the diversity challenges that you face at USAID?
Sure. So I am the director of USAID's Office of Civil Rights and Diversity, and a large part of that is dealing with complaints, EEO complaints that might come in, requests for accommodations, harassment inquiries, that sort of thing. But another big part of what we do is diversity and inclusion, and we want to have a strong, robust diversity and inclusion program so that there is not a need for employees to feel the need to engage in the EEO process. We certainly don't want to discourage people from employees from filing complaints, but we want to create an environment where employees feel free to discuss things and they feel like a sense of uniqueness and belongingness and can contribute to solving the great problems and providing solutions to the great problems that are in the development world. So we think diversity achieves that.
Yeah, and I really like that because it's really an emphasis on preventative care in a way in terms of USAID. What are the types of programs and projects that you're most proud of right now in terms of increasing that level of diversity and conversation?
Well, there's a couple of things. I mean, I've only been at USAID since September, and so we're first need to staff up our office and then roll out these programs. But we have started to do a couple of things, which is one, to not just focus on USAID in Washington, D.C., but to also focus on the missions around the world and making sure that the employees, whether they be Americans or whether they're foreign service nationals, are all part of the conversation and are all contributing and feeling empowered to contribute to solve the global problems of in development. So some of the things that we've done is I have personally gone out to USAID's Nepal and India mission and have conducted diversity and inclusion training. I have partnered very closely with OPM's diversity and inclusion program. They have some great programs on diversity and inclusion. The new IQ is one of them, which is really focusing and trying to get the message out that diversity and inclusion is not just a good thing. It's not just, the right thing. It's not just it's against the law to discriminate, but actually making the business case for why diversity and inclusion is so critical to solving problems. And we're getting more and more evidence to support the idea that groups have to solve the problems, that groups trump individuals, and that diverse groups with different experiences, different perspectives solve problems better, faster than homogenous groups. And so we're really trying to roll out that idea by doing trainings on that. We have a couple other pilot programs we want to do in terms of working with our employees to feel like kind of like another program that started at OPM, a diversity and inclusion dialogue program where employees can meet and discuss diversity and inclusion issues about privilege, unconscious bias, all those things that might impact us in the workplace and might impact decisions in hiring and promoting and solving problems. So that's part of what we want to do. We'll also have another pilot program that we're planning on rolling out, which is really to try to reach out to we already have we already do recruitment and outreach for undergraduates and graduates, but also we feel the need that we need to get students before that. So we want to roll out a pilot program with middle schools and high schools in the local area, trying to bring them in, see what USAID is about, see what working for the federal government is about, and trying to reach students that we may lose if we don't get to them at that earlier level.
Well, that's a great segue into my next question, which is, how do you see this unfolding in the future? Because it's just a beautiful example of getting into high schools, getting into institutions of higher learning, and rolling that forward potentially into USAID in the future. So what do you think are some of the obstacles that prevent, or some of the strategies that make that even more effective?
Okay, so I guess some of the obstacles would be, one, we need to make sure that there is significant attention paid to diversity and inclusion. And, I think that's not always the case. At several agencies, there's a mission. There's this mission, and that's our first focus. And diversity and inclusion is kind of like, something that you do when you get around to it. That hasn't been my experience at USAID. The leadership is very supportive of all of our efforts. So we feel like, we have really a great opportunity to really bring in a mentality of applicants as well as hiring officials who all buy into the idea that diversity and inclusion is critical, and that we can roll out programs like that we're thinking about rolling out. And we hope that, this will allow USAID to be the top, agency for solving development issues around the world.
Great. Well, one of the things that I wanted to get to next is to talk a little bit about this cross-sector opportunities, where we talk about companies, multinational companies, or companies in the public or private sector partnering with folks in the public sector, focusing also on partnerships with nonprofits or NGOs. And I'm just wondering what, based on this approach to diversity and inclusion, what do you see are the benefits in terms of coming against those on a cross-sector basis?
Well, I think USAID has already seen the benefits of bringing in all the different types of public sector, private sector, NGOs, and there's been an emphasis on including all of that. And that's, I think, been different from maybe prior administrations. So that we are certainly focused on bringing everybody in. But as we see that in the diversity and inclusion world, we also adopt that, and not, I've always felt the need to do that. I mean, we work with private sector organizations to provide diversity and inclusion training. We provide diversity and inclusion training, and we have public sector groups that we work with as well. So again, we're preaching diversity and inclusion and getting the different perspectives from the private sector, the federal sector, the NGOs involved in the diversity and inclusion discussion is critical. Even when we look at USAID itself, we have an executive diversity council. That's the senior leadership working on diversity and inclusion matters. We have employee resource groups, which are like employees of various different groups, and anyone can join them, but they focus on trying to address, concerns that maybe a particular group has. And so getting their perspective and their opinions, again, promotes this idea of getting all the various opinions, because we can come up with creative and innovative solutions.
Right. Really playing to people's strengths, playing to different ways of looking at the world, whether that's a cultural diversity, a geographical diversity, a sectorial diversity. We've had some questions come in through Twitter, so you've obviously piqued some curiosity. So one of the questions that we had that's come in is, what regions in the world are most difficult to field diverse, highly qualified folks in terms of development?
Well, I think, I don't know if I can really answer for global health fellows. That might be an issue, a question for one of the next speakers. But in terms of diversity in
more
general,
broadly,
I mean, there's some thought that, well, people who, there's certain parts of the country, certain parts of the world are less willing to embrace some sort of diversity on some levels, whether it be LGBT or women's issues or that sort of thing. My experience really is not that's not the case, that there is discrimination and people who engage in that sort of behavior all over the world.
Okay, so we're all equal opportunity.
And there's a need to address it everywhere. And so, we've been in Asia. We're looking to next go into either Africa or Latin America, South America, but we plan to go to Europe. I mean, there's lots of places where we need to get this message out, and we need to spread it throughout all of USAID.
The diversity and inclusion is essentially a leading strategy for development.
Yes.
I think that's a terrific message, and I just want to thank you so much for joining our panel discussion today. Thank you very much for joining us from USAID.
Thank you. I appreciate the opportunity to be here.
Wonderful. So 2015 is our 25th anniversary here at PYXERA Global, and over the last 25 years, we've collaborated with tens of thousands of people in more than 90 countries around the world, crossing borders of all kinds. And that's just the kind of community that we want to continue to create, both virtually and in person, a borderless community. On the screen is pyxeraglobal.org/borderless, and we're inviting you to go to that spot on the web to join our borderless community, which unites people passionate about creating positive change in the world around them. Being a part of this community can strengthen our collective commitment to purposeful global engagement by amplifying the stories of impact that continuously inspire all of us to do even more. If you're watching, we think you belong in this community, so we hope you'll sign up. And I promise you will never be solicited for anything more but your stories, your good ideas, and your experiences. My next guest is Sharon Rudy. Sharon is the director of the Global Health Fellows Program 2 at the Public Health Institute. Global Health Fellows Program 2 helps USAID address its immediate and emerging human capital needs by developing a diverse group of global health professionals to support and sustain the effectiveness of the agency's current and future health programs. In addition, the program also includes diverse elements from across sectors by integrating employees of multinational corporations as global health champions in short-term assignments, which align with the USAID Global Health Agenda. I'm just delighted to have you here today.
Thanks.
Welcome, Sharon.
Thank you.
So let's start by sharing with the audience a little bit more about the Global Health Fellows Program 2 and its work in diversifying the global workforce for global health.
So when USAID created GHFP, they provided a mandate to really help build this next generation of global health professionals. And in particular, they wanted this profession to reflect the American people in all its diversity. So we have been working in that area, and I'm happy to say that over 40% of our fellows do identify as being a member of an underrepresented group. And fellowships, by the way, are 2 to 4 year. It's their jobs. You work 2 to 4 years inside USAID, both in Washington or overseas, and you can do very senior work, very junior work, all kinds of different work that they do. We did this. Our strategy in getting to this point in terms of the diversity of our fellowship was a couple things. We started with an aggressive outreach program with minority serving institutions and HBCUs, historically Black colleges and universities. And we discovered that they did not have a lot of robust global health training programs. So we were partnering with the Consortium of Universities for Global Health to sort of influence that, because I think it's a great time for minorities to come into this profession. The second thing we did is we started reaching down into the younger ages when people actually make career decisions, and really encouraging people to have this sense of self-efficacy, that they actually, they could have this vision of what global health is and that they could work in this setting. And so we work with Globe Med, who sets up student-run clubs in undergraduate level. And we also work with a great group called the Faces for the Future, which work with at-risk high school kids. And they've developed a global health set of modules in their training program. The other thing that we do is to influence the federal professional staff, the government workers that we work with in the recruitment process. And they're fabulous. I mean, these are all international development experts. They work, they've lived and worked overseas. They're true global citizens, but they're also human. And that means that they struggle, as we all do, with issues of things like unconscious bias. So we work with them in the recruitment and the retention process too, because it's not just about recruitment. It's also about making sure that environment is welcoming and people feel connected
And people are integrated.
Exactly. And so we support all the work that Juan Carlos, your previous speaker, is doing in terms of the systems and processes that support a diverse workforce as well.
Excellent. Well, how does the partnership with PYXERA Global then fit into that?
Our PYXERA Global participants, whom we call Global Health Champions, are private sector corporate participants, and so in our world, they expand the universe and the diversity of our participant group in a very significant way. They're a reflection of actually diversity of our program. And what happens, what we see with them is that they, you take a mid and senior level corporate professional and you put them into an NGO or at some setting in a lower and middle income country. And it's an experience of total cultural immersion. And the research on the impact of that is very significant. It can be a transformational experience. And so we really enjoy these accomplished, high-performing professionals going back to their corporate world slightly different than the way they left.
Absolutely.
And what happens is they become, because they've had this community level experience, they understand who that end user is of that product or service or whatever it is that organization is connecting with the lower middle income countries. And they become an informed voice for that end user. And we think that's great.
Right. It's a classic win-win because
absolutely.
we have capacity building on one side and new perspective and respect on another side.
Exactly.
So it becomes transformational for all of it. So in thinking about the global health talent pipeline, who comes into the workforce and how do they get there? How do you get into underrepresented communities? So you've talked a little bit about the organizations that you're working with in terms of exposing them, but what's your vision going forward for the future? What is the perfect world that you'd like to see?
Oh, I love that. Well, people come into this workforce from all different places, and it's not a particularly narrow door, although it seems like that if you're knocking on it. It certainly seems like that. What we have found really is important is for people to take the time to develop a personal vision. Why is it that they want to do this kind of work? What is their gut telling them? And how passionate are they about if it's a special population or a technical area or a clinical area or a skill set? What is it about the profession that is calling them? And the clearer they are about that and the more passionate they are about that, the better interviewer they are when they're job hunting. So the other thing in terms of vision and passion is they need to have a good resume and they need to have good interviewing skills. And those two pieces are completely teachable. And what we find with our underrepresented groups is sometimes they've missed the opportunity to learn that where someone with more resources would have had that opportunity. So our program tries to plug that in with webinars and tools and job aids and that sort of thing. And we work with, we go to 60 to 80 universities and events a year, and we do about 25 informational interviews a month. So we have a lot of opportunities to do that. So besides that, unfortunately, right now in this industry, you need to have a master's degree. It can be a lot of different types of things, but you really do need to have a master's degree, and you need to have some kind of overseas experience, some sort of working and living overseas experience. And the other thing that we talk with our candidates and people that are interested in this kind of career and then identify as being from underrepresented groups is to identify your distance traveled story. How did you get from where you are to where you were to where you are now? And that really helps you value who you are. And if you feel passionate about the work, if you have a vision for what you want to do, and if you're clear about the value that you bring, you're an unstoppable interviewee. It's a very powerful experience.
That's just a great message for everyone, not just
really
global
exactly.
health. It's
Really,
wonderful to
really.
say that. So one of the things that, as we're talking about this, what can we do then as social sector partners, to continue that excellence towards global health? And also to comment, when I first came into this space, I thought global health meant healthcare. And you helped me to understand that it was so much bigger than
everything.
Healthcare. So do you want to
In
comment
fact,
a little bit about that?
Most of people who work in international development are not service providers. They're looking at systems. They're looking at developing new knowledge in all these technical areas. They're looking at service processes, delivery, all kind. There isn't anything that you can do in health that isn't going to be helpful to the industry. I think that this group, social sector partners, really have a great opportunity because many of you are hiring and working global health. You hire global health professionals. You can join the conversation about what it takes to be a successful global health professional. What are the competencies that really matter? We've recently did a study of, we interviewed 49 experienced global health program directors, and we discovered this gap between what people are trained to do and what they need to do. And one of the important things they need to do is they need to have very good skills in collaboration. They need to be very good communicators, and they need very good monitoring and evaluation skills. So they need to know how to write a proposal. They need to know, how to run a project. Those are some technical areas that your a social sector partner really understands, but academia might not be that tuned into, especially if they're not bidding on and implementing projects in global health. So joining that conversation would be good. And the other piece of the conversation is the local global interaction. Can you be a domestic public health profession and be a successful professional and be a successful global health professional? We're opening up that conversation, and we invite people to say their piece.
And that's wonderful. And I know that in that conversation, people can join that conversation by hashtag global health, as well as hashtag PYXERA Global 25 on today. So
Super.
Thank you so much, Sharon, for
welcome.
joining us. We just really, really, really appreciated that. The webcast today is part of a series of virtual events that highlights the post-millennial development goals that will be ratified by the United Nations in September. We'll be covering many of the 17 Sustainable Development Goals leading up to our conference, which is the Global Engagement Forum on November 10th and 11th here in Washington, D.C. We invite everyone who's watching today to come to Washington for that forum, but we know that many of you won't be able to join us in person. And if that's the case, we'll be broadcasting from the museum on the morning of November 12th. So I encourage all of you to hold the dates, November 10th, 11th, and even in the 12th, we will have a diverse group present online with us. Hello, I'm so glad to welcome my final guest here today, John Crockett. Thank you for joining us.
It's a pleasure. Thank you.
John is the Senior Program Manager for the Biosecurity Engagement Program at CRDF Global, a nonprofit organization that promotes international scientific and technical collaboration. John leads a team that implements projects that reduce the risks posed by biological threats. In the dozens of countries where they are active, the overarching goal is to work with governments, scientists, and other stakeholders to build sustainable capacity for biosecurity, biosafety, disease surveillance, and cooperative scientific research. That sounds like a huge portfolio, and I'm so glad that somebody has their eye on that. Thank you for joining us, John.
Thank you very much. I'm glad to be here.
Wonderful. So in your experience in the different countries and subjects, why is diversity so important?
Well, I think in this topic, it's absolutely essential, as in most things, because the problems we deal with in global health are very personal and they're deeply cultural. And to be able to approach those with solutions that are going to push the ball forward, you have to have people who have diversity both in skill set, but also in the way they see the world. And I think we've benefited greatly here in the U.S. from having a diverse staff. But it's absolutely essential that we go out to the field to solve some of the big problems that we're all talking about today, Ebola and anthrax and avian flu, that we're working with local partners and people on the ground who deeply understand the culture that this is occurring in and have the personal connection and ability to be innovative around these problems.
So the personal connection, the innovation, and frankly, the context in which to understand. So what's an example of a program that you're particularly proud of that has become even more successful because of a diverse perspective or a diverse team?
Right. Well, I think, one of our unique sort of programs is our fellowships, and that's been something that's been mentioned earlier today. We do a fellowship in non-proliferation for women in non-proliferation, and bringing women who are scientists.
So talk a little bit more about what the role of a fellow in non-proliferation would do and why bringing women into that has been novel, innovative, and
I hope
valuable.
I hope it's not novel, but we'll say it is. I think it's been helpful because we've engaged a number of scientists because of cultural reasons or other reasons would not have had the opportunity to work in an environment where they have the networks, the global networks. And again, these are very global. The technical aspects of being a scientist means that your connection to the rest of the world is very important. So the fellowship brings these women fellows who are selected competitively to the United States, where they have an academic experience, where we can fill in potential gaps in their technical area. But what it really does, and I think the important part of the fellowship that we get so much feedback for, is it really puts these women in a network of other professionals who one can empathize with what it means to be a woman scientist in lots of parts of the world. Unfortunately, it's not as easy sometimes as it should be. And then they go back with that fellowship knowledge, that network, to their home country, and they do a project actually. And that's a funded project. So they get an opportunity to engage the world and then to go back to their home country and use that knowledge in what we call a capstone project back in their country. Our current fellows from the Philippines, and we've seen that we were able to take someone who had great aspirations, had great talent, but really needed an opportunity to expand that network and that technical knowledge to go back. And we feel like this, like many of our fellows, is going to go back to the Philippines and really take on some of the unique challenges of that country. That she sees it in a way that maybe other people wouldn't have seen.
Mm-hmm. No, that's a great example. Thank you. So as we're talking about this, the value of linking scientists and the scientific community, it just kind of strikes me as sort of an easy gate through borders, because scientists have a lot in common with each other that crosses those borders. So let's talk a little bit about valuing and linking and partnering, not only with individuals, but also with organizations and various academic institutions and research facilities. And I'm just wondering how you've seen diversity help play a role in making those linkages as well.
Great. And I'll go back quickly just to one thing you just said about, we have an approach called science diplomacy. And I think part of GHFP Global's roots was in the breakup of the former Soviet Union. We found that the relationships that occurred between the two countries during those periods of real disengagement between the United States and the former Soviet Union were really important diplomatically as well as scientifically.
Okay.
And they endured the low points of the relationship. So with that sort of context, I think what we
that sort of people to people engagement as opposed to only government to government.
The government to government can go very differently than the people to people. And I think we see that in today's world as well. So we feel like leading that into institutions, we feel like these institutional partnerships that we have are very enduring. They very much reflect the context of the country, again, as the individuals do. But the sustainability of these programs over the long term are really built into the institutions of the countries. GHFP Global is a strong organization, but we know that a local university can build capacity for years and years well after we're gone, or that a local institution can deal with these deeply cultural things that are happening in their country much better than we can. So we almost immediately in every project either have identified a local partner or a local partner will come to us initially to develop a program. We feel like that's, again, absolutely vital to our success.
Oh, wonderful. Well, we're getting close to wrapping up our discussion today. So my last question to you has to do with bringing in the private sector. So we've talked about public sector, we talked about how to get scientists, academics, nonprofit organizations, but how do we bring in private sector players into the fold to help bring those core competencies, that additional diversity to address global health challenges?
Great. Well, I think one of the most important aspects of the private sector is the frameworks they bring for entrepreneurship and innovation. When you think about some of the well-known names in the private sector, their culture breeds that, and I think we want to copy that and bring that into our framework as well. The other thing is technology. Global health can be deeply technical, and there are oftentimes technical solutions that we need to work with in a local context. So bringing those private partners in, giving them a problem to solve. Oftentimes we, as a nonprofit, where people think we're coming ready to ask for money, but I think a lot of times we want to do is have a partner in solving a problem. And the private sector is very good at solving problems. And I think not to include the private sector would be the same as not including diverse people. It would leave out a huge aspect of the innovation and the energy we need to solve these big problems.
Well, excellent. Well, thank you so much for joining us today, John. We just really, really appreciate that. And I thank all of you for joining us today in this discussion on diversity and global health and moving forward to a great global environment to solve the world challenges facing us today. Please do check our website for future webcasts and keep in mind the November 10th, 11th, and 12th opportunities. Thank you.